Feline peritonitis symptoms and treatment. Feline infectious peritonitis, FIP, is a viral disease that affects cats. The causative agent of feline peritonitis is a coronavirus called feline coronavirus, FCOV, which is present in about 40% of cats. Feline peritonitis occurs when FCOV mutates, causing a serious and often fatal disease. In this time, we'll discuss the symptoms and treatment of feline peritonitis in cats. Feline infectious peritonitis comes in two forms: the exudative, wet, form and the non-exudative, dry, form. Symptoms of the exudative form include abdominal distension, weight loss, fever, and coma. The cat's abdomen looks bloated due to fluid buildup. In severe cases, the cat may have trouble breathing due to the pressure the fluid is putting on the lungs. Other symptoms of exudative feline peritonitis include loss of appetite, vomiting, and diarrhea. Non-exudative feline peritonitis occurs less frequently than exudative peritonitis, and the symptoms of non-exudative feline peritonitis may not be as pronounced as those of exudative peritonitis. Symptoms are similar to those of exudative feline peritonitis, such as weight loss, fever, and lethargy, but there is no fluid buildup and therefore no abdominal distension. Because of this, non-exudative feline peritonitis is harder to detect than exudative feline peritonitis. Other symptoms include difficulty breathing due to inflammation of the lungs, and it can affect the eyes and nervous system, causing neurological symptoms such as seizures, paralysis, and blindness. Feline peritonitis can be difficult to diagnose quickly because the symptoms overlap with those of other diseases. The most common diagnostic test for feline peritonitis is a blood test that looks for the presence of antibodies to FCOV. However, this test is not always accurate, as cats can test positive for FCOV without having peritonitis. That's why diagnosing feline peritonitis is very much a veterinarian's experience. In some cases, a tissue sample may be required to confirm the diagnosis. This is usually done through a biopsy of the affected organ or fluid aspirated from the abdomen. There is currently no cure for feline peritonitis, so treatment aims to manage symptoms and improve the quality of life of a diagnosed cat. In some cases, cats can recover on their own, but in others, the disease progresses rapidly and leads to death. Treatment options for feline peritonitis include: 1. Supportive care. Supportive care involves providing the necessary care to improve the cat's quality of life. This includes proper nutrition through intravenous fluids, hydration, and pain management with medications. 2. Corticosteroids. Corticosteroids are used to reduce inflammation and can help improve your cat's quality of life. However, they are not a cure for feline peritonitis and should be used with caution. 3. Antivirals. Antivirals have been used to treat feline peritonitis, but their effectiveness is still controversial. Some studies have shown that antivirals can improve the cat's condition, but other studies have shown no benefit. 4. Immunomodulators. These drugs help regulate the immune system and can be used to manage feline peritonitis symptoms. Immunomodulators are often used in combination with other treatments. Preventing feline peritonitis can be difficult because the virus is so widespread in the cat population. However, there are several steps you can take to reduce the risk of feline peritonitis. 1. Vaccination. An FCOV vaccine is available, but its effectiveness is controversial. It is recommended for cats that are at high risk of developing feline peritonitis, such as those living in multi-cat households or breeding facilities. 2. Hygiene. Maintaining good hygiene can greatly reduce the risk of developing peritonitis. Wash your hands when you get home from going out, especially before and after touching your cat. Clean your cat's litter box and food and water dishes regularly. 3. Separate sick cats. If you suspect your cat has peritonitis, even if it hasn't been diagnosed, you should separate them until you get to the vet, just in case. 4. Manage stress. Stress can weaken the immune system, making your cat more susceptible to feline peritonitis. Manage stress by playing with your cat often and giving them nutritious treats. Feline infectious peritonitis is a serious viral disease that affects cats worldwide. The symptoms of feline peritonitis can be difficult to diagnose, and there is currently no cure for the disease. Treatment should be aimed at managing symptoms and improving the quality of life of the affected cat. Preventing feline peritonitis can be difficult, but measures such as vaccination, good hygiene, separation of sick cats, and stress management can help reduce the risk of feline peritonitis. If you suspect your cat may have peritonitis, or if you notice some of the symptoms, it's important to consult your veterinarian immediately for a prompt diagnosis and appropriate treatment. Thanks for watching.